Hello and welcome to today's webinar, Patient Payments, Trends from the Emergency Room Physician Perspective. Today we will be reviewing trends and issues in patient payments, the impact of high deductible plans, anticipated methodologies for pursuing patient payments, and at the end we will provide an overview of the new T-System RevCycle Plus solutions. My name is Ann Beatty. I'm T-System Senior Marketing Coordinator, and in just a moment we'll be joined by our presenter. If you have any questions that you would like to submit for the Q&A at the end of the webinar, click on the icon with the question mark and type in your question at any point throughout the webinar. We will gather these questions and try to address as many as time permits at the end of the session. If we don't get to your question, we will follow up with you one-on-one. We will have a recorded version of the webinar in the event that you want to go back and review the material, or if you want to share the presentation with a colleague who is unable to attend. I will distribute the recording of this event to all attendees. Leading our discussion today is Bill Stone, T-System's Corporate Director of RevCycle Plus. Bill has worked with over 400 billing companies in his career and has 18 years of experience in the physician services industry. And now to kick off our presentation is Bill Stone.
Well, good afternoon, and certainly welcome to our call today. Excited about our conversation topics that we'll be covering today. And certainly thank you for the introduction, very kind words. A little bit about what we're going to talk about today are trends and issues from the patient perspective and what we're seeing in the emergency room across the country. Begin to formulate some of the impacts of high deductible health plans, and then also what we're beginning to see as some newer methodologies for pursuing patient payments across the country within the emergency room. With that, I thought I would start with probably some information a number of you seen this week out certainly in the New York Times and USA Today with some information from the census. One of the things that we're seeing within the population across the country, the median net income was reported this week have dropped from 2007 at $49,600 for a family to 2010 of $45,800. The more startling fact was really the drop in median net worth of families from $126,400 to $77,300. The analysts and the economists in the country really reporting that the biggest driving factor of that were housing and retirement, and certainly the impact of housing and the decline after the crash in 2008 certainly having an impact. This then coupled with basically a flat growth in net income from 2000 to 2007 with the beginning of the recession in 2008. Why is this important? Certainly, we begin to see in this particular decade the growth and the launch of high deductible health plans. Certainly today we've seen that deductibles range for individuals, for families, anywhere from $1,200 to $2,400 for individuals depending on the plan type, and we've seen families grow from $4,000 to $8,000 for family coverage. Couple that with the previous slide with the decline in median net family income, certainly at $4,000 to $8,000 for a family, a substantial impact on the family's net income. Also reported as a byproduct of the census data, a really interesting figure that over 50% of all companies now are now using high deductible plans. That doesn't mean that all of those employees are using, have adopted that plan, where certainly here at T-System we have two different plan types for employees, both a high deductible plan type and a more traditional plan type. But we see companies across the country. What's not reported here on the slide was that from 2010 to 2011 was a 26% growth in high deductible health plans. We've seen in the group market and the individual market the enrollees all but double from 2008 to 2011, sort of as symbolic of this growth within the high deductible and the employer side of the industry is this, the cartoon over here, and I think it certainly what employers are seeking to do is engage their employees and their families in the healthcare purchasing process. And we see here the patient getting unloaded, talking to the emergency room physician that he wanted a price estimate for what the ER services are going to cost. Payment trends. Sort of coupled now with facts leading up to this. In 2007, while a dated McKinsey report, very applicable, it was reported in that 2007 McKinsey report that if payments, there was a 95% chance of collecting the payments if collected at time of service. Their report at that time was 18% of payments collected 1 month beyond date of service had an 18% chance of being collected, or total payments being collected. They also projected in that same report that 35% of the providers' payments, or in the case of emergency room physicians, what will net about to be 35% of the income will now come from the patients, and that was reported to have come by 2010. Here at T-System, in preparation for this webinar, we pulled a sampling of visits of over 275,000 visits. And what we found within that sampling from 2011, that 19% of those visits were classic self-pay visits, 24% had some form of a high deductible health plan, and 57% had a government or commercial-based insurance responsibility. So using that as a statistic, we could say 43% potentially in this particular case of this sampling would actually come from the patients themselves, and or if you took out the factor of the self-pay and said that in some cases that may not be collectible, that net using 24% and 57%, you're going to come pretty close to what the McKinsey report had projected back in 2007. So certainly, as we begin to think about census data and plan types from the employers, certainly these are huge impacts for all of us within the emergency room. One of the most underreported, and I think very important for those of us that spend time and work within the emergency room setting, is what I'll call the unbanked, or what's been characterized as the unbanked or underbanked. In looking at a 2009 FDIC report, it was estimated that 7.7% of the U.S. households were unbanked, and then approximately 18% of the U.S. households were underbanked. So it's important from a definition standpoint what that means as we think about pursuit and working with patients in a collaborative fashion for payment for emergency room services. Effectively saying an underbanked individual does not have a typically traditional financial services, credit cards or checking accounts. Underbanked folks that are categorized as underbanked typically they purchase money orders, they utilize check cashing services, or they pay bills in cash, where completely unbanked, the 7.7% traditionally are just straight cash. So if we begin to think about it within our settings across the United States, 1 in 4 individuals effectively are underbanked and are not going to have a traditional checking account. So I think a fairly powerful number that oftentimes that's not reported. The question is, what are we seeing across the industry at this point? What are specialties beginning to do? And I'll start with our brethren in the traditional ambulatory specialties and primary care, internal medicine, pediatrics. And in some cases, we're beginning to see the emerging trend of some of these folks taking lessons from the hotel industry. We're beginning to continue to see the rise in the ambulatory sector of folks limiting their practice and offering high-touch services to patients. Membership can typically range in those settings from $750 to $1,500 a patient on an annual fee, and then the practice is additionally billing the insurance companies for their ongoing visits. And then from a practice panel, they're typically limiting the size of their panels anywhere from 500 to 750 patients. Certainly not applicable in the ER space, but certainly one of the things that they're doing on that side. Additionally, you're seeing a lot more of the practices typically mirror what's been happening in the dental and what's happened for years within the dental industry or even within plastic surgery. We're beginning, still where it used to be a few years back, collecting payments online is now somewhat old school. We're seeing providers actually accept credit cards and maintain credit cards on file. We're also seeing providers begin to adopt technology that allows them real time at that point of care to use patient estimation tools and to use those tools and go ahead and collect on what would be that deductible or the portion of the payment at that time of care, even before they submit it that same day out to the insurance company. Well, what are we doing in the ER space? And certainly the physicians are working hard. We're seeing a lot of patients come through the emergency room. There's questions, what's going to happen with the Accountable Care Act? Or will we see more velocity coming into the emergency room settings? We're seeing a lot more people without jobs, in some cases that are coming in our docs. And our extenders within the ER settings are working hard and seeing patients. But as a norm, and as we look across the industry at a number of different organizations, there's been zero pursuit of the patient at point of care. And so certainly for all of our purposes, we see the patients, effectively our docs have worked hard, they've delivered the care, and then the patients are really running out the door. They're holding their dollars in their pocket. And so if you go back to a little bit on what we talked about earlier from the McKinsey and the studies, those studies, and even some of the things that we've seen within T systems, we're going to see and project probably that a physician's incomes could jump from as much as 35 to 50% of the patient portion of care. So certainly in the ER setting, that's a very compelling number that from an administrative standpoint and from a physician standpoint is going to be something that we're all very mindful of. So here's where we kind of get into a bit of where we're seeing some things go within the ER setting. Interestingly enough, if we think about vending or I guess a new word, automatic retailing, as it's increasingly known as, really has a long history. A Greek mathematician about 215 BC invented a machine that would vend holy water in the Egyptian temples. Now, I'm a good Presbyterian, so I'm hoping that my pastor this Sunday doesn't have a vending machine for holy water. But apparently that's where vending machines, automatic retailing sort of had their launch. In sort of as we see the patient kiosk as a byproduct of this beginning to present itself, so a report that came out recently from the Federal Reserve that 67% of all payments made in the United States were either done by credit card, ACH, electronic balance transfer, and debit card, and 33% of all payments were done either in cash or by some form of paper instrument. And so back to some of our unbanked conversations. Most people have become accustomed to, and certainly my children are no different, they absolutely love going to the grocery store and using the kiosk, the self-checkout. We're seeing across the country utilities and cities. I grew up in an area that used to be able to pay your utility payments at the grocery store. Now there are vending kiosks where you can actually pay your utility payments across the country. If you've spent any time in an airport, you certainly see those as well. In Kansas City, there was a quote from an executive affiliated with one of their utilities, the gas service, and they're seeing a marked group of individuals, 45 years and younger, supposedly the computer generation as the primary users of self-service bill pay kiosks. The quote was, younger generation typically doesn't want to deal with people. They'd rather just go to the web or to a kiosk. As we think about the kiosk industry, as I've traveled through numerous airports, you see the Best Buy kiosks. You can buy headphones. You can buy an iPod. You can do a number of things. You see the red boxes. If you want to rent a DVD, typically you see those at CVS, Walgreens, and a lot of the different grocery stores. Similar to what we talked about with the Kansas City, you're seeing bill pay kiosks begin to adopt across the country. And in the lower right of this slide, a lot of hotels now are using kiosks basically to check in and actually get your card so you can go directly to your room, and using the same kiosk in many cases to actually check out. How are we seeing that happen in medicine? Here in this particular graphic, a couple of different, two or three different scenarios. In the UK, as well as here in the States, physician practices as well as healthcare organizations are beginning to use kiosks for scripts. There's some this week and next week in Washington. Depending on the tier, there's some conversations that are now having and testimony on being able to do higher categories of pharmaceuticals out of these kiosks, but certainly kiosks are being used for delivery of prescriptions. We're also seeing institutions begin to adopt eligibility, self-check eligibility kiosks in the doors. And another emerging piece that we're seeing as well in the lower right-hand corner in the banking industry is evaluating and using some of these same kiosks. If you can see the picture of the individual, in this particular case, it's the pharmacist literally talking to somebody via the phone while they're there at the kiosk to be able to dispense this. So put this in the frame of reference from an emergency room and thinking about being able to talk to folks, whether it's to settle your bill or do things like that, as you potentially would exit the emergency room. So the banking industry is adopting this type of technology for having the virtual teller. So literally they can talk to the teller through the kiosk. Point of care. A number of organizations that we've interviewed and visited with are also looking at technologies similar to what you see, and if any of you have been in an Apple store recently, using point-of-care devices to actually pay for that care. And you see in the lower left-hand corner, I recently purchased an iPad 3, and that's how I signed for payment for that iPad. They swiped it. And so these devices are now making their way, and this methodology is beginning to make its way into the healthcare setting. Cash accepting devices. Certainly, with the cash accepting devices on top of many of the kiosks today can only accept credit cards or credit card payments. But more the prevalent, a lot of the Fortune 500 companies are adopting cash accepting devices. Home Depot, a lot of the major grocery store chains all have those devices within the store where they can accept cash and offer change. And for underbanked or unbanked clientele, oftentimes they may have hundreds of dollars within their pockets, but no way once they leave the ER without having to actually come to the billing company itself to actually pay for those services. So we think that certainly having evaluating strategies within the emergency room to accept this type of transaction will become critical and important. So from just a general conclusion standpoint, as far as some trends that we think that as you all are assessing, for the physicians and the administrative staff supporting the physicians out in the emergency rooms, easily with 50% of the insured patients having access to high deductible plans and to ability to capture those payments from those patients in a timely fashion is going to dramatically affect physician income. And so we're actually expecting it to move certainly higher beyond the 50% in the coming years. 25% of Americans are considered underbanked or unbanked, and in many cases, those Americans do not have insurance. So the ability to accept cash and cash-based credit cards, a lot of the payday loan centers, when people go cash the check, they'll actually put it on, instead of giving them cash, they'll put it on a Visa or a MasterCard with that amount of cash on it. So the ability to accept either cash or those type of transactions, we believe will be incredibly important. Both kiosk and mobile applications, we think within the emergency room, and this is going to be a big change, we think kiosk and mobile applications within the emergency room will become more and more of a norm. As a byproduct of this, if we think about back to the McKinsey study, where roughly once that patient's gone, in a lot of cases, maybe on average 18% of those dollars are collectible, we believe that there's an opportunity and a willingness of customers actually to pay for their care if they have some opportunities to pay there within the emergency room setting. So with that, just a quick note about some of the things that we're doing here at T-Systems, and then I'll open up. Already have a couple of questions that have come across. Just a quick note, this week we launched our RevCycle Plus service line within T-Systems, both in our facility as well as in our professional service line, working in the coding and compliance, offering coding and compliance services, offering a web-based revenue cycle process with a highly developed coding engine, using some really interesting technology and what an IBM coined term called autonomics. We believe that automation, we believe it's old school to believe and only be checking claim status 8 to 5. We think that that's a 24/7 process. Also, we'll be offering in sort of intelligent data, business reporting. This year, our estimated volume within this service line, we'll code in excess of 7.5 million visits and probably process in excess of about, on behalf of clients and physicians, over $385 million in revenue. So just a quick note about what we're doing this week. Some of you may have seen the press release in anticipation of this presentation. And with that, I'll turn it over to a couple of questions, and Ann, why don't you go ahead and give us our first question?
Absolutely. Thank you, Bill. Our first question is, do you expect to see high deductible plans continue to grow?
Yeah, as mentioned during the presentation, at 50%, with the employers offering 50%, 50% of the employers offering high deductible plans, and the staggering growth from 2010 to 2011, there's nothing at this point, as we've listened to the brokerage community and the employer community, that will lead us to believe. I don't think we'll see the 26% growth, but certainly a 5 to 8% growth we think will continue within the high deductible basis.
Okay, great. Next question, how does the underbanked population overlap with the commercial population? What percentage of that 7% has insurance? The FDIC report, I could not develop a correlation between the FDIC report as well as the amount of folks that actually have. Certainly, I would say from a statistical standpoint, there is a cross-correlation there, and you have to expect that many families are in that 1 in 4 that are underbanked or unbanked, that in many cases that they are part of that 50% population that have high deductible plans. So, but I didn't have, for the purposes of this presentation, that correlation. But we'll certainly, as we come across that, I'll send that out. Okay. Next question, are healthcare facilities really embracing the kiosk technology?
Yeah, that great question, and absolutely, because facilities are embracing kiosks not only from a customer service standpoint, but a patient registration standpoint, but also looking at plans both in the ambulatory sector as well as in the inpatient sector of additional means of setting up payment plans, accepting payments, and it's actually delivering a higher value of service. Also looking at tools to offer customer service surveys and dispense, information out, patient education material out to the patients.
Okay, thank you. That was actually our last question, so that's going to conclude the Q&A and today's webinar. On behalf of T-Systems, thank you for joining us.